Hello everyone, this is Dr. Akileshwar Reddy, Cardiologist. Welcome to Heart Health Made Simple. So today I am going to discuss one of the most commonly asked doubt by my patient, that is what is an ECG, how ECG has to be done and what ECG cannot detect. Number one is what is basically an ECG. ECG is electrocardiogram. It is one of the simple, painless and quickest tests that will detect the electrical activity of the heart. So number two, so how is ECG has to be done? So basically ECG will be done in just 2 minutes. You just have to lie flat on the bed. Technician will connect the wires or leads into your chest, heart, legs and your hands. So on this wire will connect to electrodes. So on this the machine will give the ECG recording in just 2 minutes. So it's one of the simplest and painless tests. There is no pain, there is no radiation, there is no shock even. So the third question is, what does an ECG show? So ECG basically shows three most important information. Number one is heart rate. So ECG will show how your heart is working, whether it is beating fast, it is slow or normal. Number two is ECG tells what is your rhythm, whether your heart is beating regularly or irregularly, that is we will call as atrial fibrillation. Number three, sometimes ECG can also detect blockages, heart attacks, or sometimes it can detect hypertension also. Number fourth question is, many patients ask me, doctor, when I should take an ECG. So basically you have to take ECG when you have these symptoms, when you have chest pain, chest tightness, breathing difficulty, when you have giddiness, when you have loss of consciousness, and when you have hypertension, diabetes. Or ECG is one of the tests that is into the basic health checkup after 40 years of age. And the important thing is, so before any patient going before any surgery, like any thyroid surgery or any surgery after 40 years of age, they should have done an ECG done. And the next question of my patient asks is, what ECG cannot do. So there is a myth that many people think that ECG can detect all the heart problems. No, never. The most important, ECG cannot detect blockages directly. Yes, ECG can show that, it can predict that you can have blockages, but it does not show how many blockages you have, how much percentage of blockages you have. ECG does not show. Further, you need an angiogram. Number two, ECG does not directly tell the pumping power of the heart, how is our heart pumping, that is ejection fraction. Number three, ECG does not show how your valves are working. So for these pumping power and valves, you need an echo. But in spite of this, ECG is one of the simplest and the easiest and earliest test to be done, because it can detect major heart attacks earlier and can prevent major damage. So to conclude, my message to my viewers is that never ignore any symptoms, as heart disease are very common in young people. So if you have any symptoms, take an ECG and consult to a nearby cardiologist immediately. Thank you.